It seems pretty clear by this email that the Public Health Agency of Canada had no intent on issuing indiscriminate masking guidance. It wasn't even on the radar. Tamara Ugolini here with Rebel News, bringing you an access to information document that shows indiscriminate masking of healthy people and mandates that followed were politically, not scientifically motivated in Canada. The communications take place between April 11th and May 16th, 2020. Now, for some context, the World Health Organization declared COVID-19 a global pandemic on March 11th, 2020.
COVID-19 can be characterized as a pandemic.
So these discussions with the Public Health Agency of Canada didn't pick up until a month later, and even then, masking was barely on the radar. And all of this came to us through an access to information requests, which is only made possible through your generous donations and support at rebelinvestigates.com. So I want to take a minute to thank you very much for chipping in there to help keep our independent and investigative journalism afloat. All right, so let's get into this document. On page number 1, an email titled Bat Signal is sent from Barbara Raymond on May 16th, 2020, which is a bit of an odd name given that the official narrative is that this virus jumped and originated somehow from a bat in Wuhan, China. Barbara Raymond is the executive medical advisor to the Vice President, HSIB, for the Public Health Agency of Canada. The HSIB appears to be the Healthcare Safety Investigations branch of the Public Health Agency of Canada. In the email, Raymond says, based on discussions this AM and comments received from Mino, I have modified the document to make clear the community settings element and the workplace relevant elements. I don't think any content was removed, although some bits have been reworded over the past several versions with MO. That's short for the Minister's Office, presumably the Minister of Health, which at the time was Liberal Cabinet member Patty Hajdu. But let's go back to the very beginning, because it all started when Canada's Chief Public Health Overlord, Theresa Tam, responded to an email from Dr. Harpreet Kochar, who was the then Associate Deputy Minister for Health Canada, but has now been upgraded to President of the Public Health Agency of Canada. On April 11th, he asked Tina Nemen-Sayaki, Senior Associate Deputy Minister at Employment and Social Development Canada, if Theresa Tam had intent to issue guidance on the use of masks when people are unable to social distance that is more definitive than what they currently have. The first sentence of Tam's response on April 12th is telling. We have no plans on providing guidance to the questions below, but looks like GC, that's Government of Canada, and OGDs, that's other government departments, want us to provide further guidance for certain settings, for example, airport or federal employees who are unable to physically distance from others, for a brief of time. She then ponders on discussion of mask use for essential service workers like truckers. Our technical experts may have started in the review of evidence, example, airports and federally regulated employees in certain settings. We need to round up the actual questions we are being asked and when we are expected to provide the advice to which table. We need to clarify who is providing the technical advice internal to PHAC, that's the Public Health Agency of Canada. And Tam says she sees it as more IDPCB. That's the Infectious Disease Prevention and Control branch, where she deflects back to Barb, who, quote, looked at some evidence on non-medical masks. Marina forwarded some documents for consideration after the clarifications above. End quote. Tam says that she can then touch base with the leads on what the advice is. It seems pretty clear by this email that the Public Health Agency of Canada had no intent on issuing indiscriminate masking guidance. It wasn't even on the radar. But Tina Nemen-Sayaki isn't pleased with that. She says that they are being asked to look to clarify guidance. What guidance do we have on general wearing of face coverings for Canadians? Think based on everything I've seen on GOC, that's Government of Canada website, we probably need to tighten to make public health positions/considerations clearer. Once we add the patterns on how to make a mask that is in and of itself will be seen as further endorsement of wearing of non-medical mask. So it was the government of Canada pressuring public health. I mean, trust the political science, right? Next, Barbara Raymond chimes in, where she confirms that the evidence supporting the effectiveness of cloth or non-medical masks or face coverings in community, non-healthcare settings is limited in quantity and quality. Her most useful read was a study in the British Medical Journal based on a belief system. Her bullet point reads, "In the face of a pandemic, the search for perfect evidence may be the enemy of good policy. As with parachutes for jumping out of airplanes," wow, what a comparison, "it is time to act without waiting for randomized control trial evidence." A recently posted preprint of a systemic review came to the same conclusion. Masks are simple, cheap, and potentially effective. We believe that worn both in the home, particularly by the person showing symptoms, and also outside the home in situations where meeting others is likely, for example, shopping and public transport, they could have a substantial impact on transmission with a relatively small impact on social and economic life. And then, of course, much of the communication thereafter is largely redacted. But on page 74, the agents at the Public Health Agency were hard at work trying to find justification for the mask mandates requested of them. Carrie Robinson from the Public Health Agency of Canada says, "We took a final review and added in language from UK reference shared by Marina on masks that Barb is also supportive of using. We will also share our scan of PT, that's provincial and territorial language on masks. Based on the UK documents, they will tell the general public that both commercially available and homemade cloth masks and medical masks can play a role." To note, the sender of this email, Carrie Robinson, is now the executive director with the Vaccine Confidence Division at the Public Health Agency of Canada. When Robinson refers to Marina, who's the person responsible for bringing those UK documents forward, that is in reference to Marina Salvadori, who is a professor in the Division of Pediatric Infectious Diseases at McGill University. And look at this, at the end of January 2020, she joined the Public Health Agency of Canada as the clinical lead for COVID-19. Since then, since January 2020, she has lived, breathed, and dreamed all things pandemic. As provinces like Ontario try to strongly recommend indiscriminate public masking and hysterical trustees like Dr. Kaplan Murr of the Ottawa District School Board bring motions forward to mask children again, remember that from the onset, this was political science, not medical science. Even doctors knew. Have a listen.
Politicians say doctors made those choices. I don't think so. I think it was like politics.
For Rebel News, I'm Tamara Ugolini. Help keep our independent investigative journalism afloat by contributing whatever you're able to at rebelinvestigates.com. While you're there, you can catch up on other exclusive reports. That website again is rebelinvestigates.com. Thank you for your support.